Hi, everyone who's joining. All right. Just welcoming you as you log on. It's great to see everyone. Just make sure your mic is muted. And we will get started. If you can see the chat, you can comment if you can hear me. And as long as the sound is going okay, we will get started in just one more minute. Great, thank you for letting me know. And for those of you who have joined, I would love for you to answer this poll and let me know if you are currently pregnant, if you are a parent who's not currently pregnant, if you're a doula or other healthcare professional or anything else. Okay, it looks like 100% of us are pregnant. So I'm right there with you, ladies and gentlemen. If we have any partners or any female partners joining at 35 weeks. So then I would also want to know, since you are all pregnant, please let me know what trimester you are currently in. Okay, so just answer the poll and let me know what trimester you're in. All right, looks like we have about 75% of us are in our third trimester. I'll keep that in mind for the webinar. And another 20-ish% of us are in our second trimester and 5% in our first trimester. So that is great to know. Thank you for your feedback. And with that, we are going to get started. And just going to get my presentation up here for you guys. So, welcome to the free masterclass on navigating pregnancy during COVID-19. I'm Ella Goldberg. I'm a Lamaze certified childbirth educator, and I have my master's in public health. I am located in Israel most of the year, although, as you can probably hear from my accent, not natively from here. I moved here 11 years ago, and I'm originally from the South Shore of Massachusetts. And we do still spend our summers on the East Coast, thanks to my husband's work, although this summer that's all up in the air because of obvious situation. So that's a little bit about me. I'm pregnant with my second baby. It's actually my third pregnancy, but second baby. So I have a 3.5-year-old son, Eitan, had a miscarriage in September of 2018 when I was 13 weeks. And now I am 35 weeks pregnant, and we don't know the gender of this baby. So with that, I do want to start with a quick disclaimer and let you know that The information in this class that I'm about to present should not replace the medical advice of your healthcare provider. And of course, you should always consult with your healthcare provider before you put any of the advice that you hear today or in general into practice. And because of the emerging nature of this topic and that things are literally changing by the day and also by the hour, I cannot guarantee that everything that I will present here is completely accurate or up to date. However, I can say that I was updating things as recently as this morning. So as of today, it is accurate. And of course, guidelines may change at any point. So before we get started, I want to invite you all who are on here live or listening to the recording to just close your eyes with me for a moment and just take a deep breath in through the nose and out through the mouth all the way. And just take one more and put your hands on your belly. And maybe your baby's moving right now, maybe not. But just focus on breathing in some clean, fresh air all the way down to your baby, and then exhaling whatever it is you don't need right now. Okay. I don't know about you all, but I really needed that moment of grounding. So with that, we are going to get started, and the format of this class will be that I will teach and present the information that I have prepared for you. I will direct you towards some resources that I know of, that I am also offering myself from my business Empowered with Ella, and we will finish up with a Q&A. So with that, I would like to start by talking about your rights, which are really important and non-negotiable, even in times of global pandemic. So the WHO, the World Health Organization, has taken upon themselves to address this global pandemic, as they do with all global health issues, and they have put out some very clear information, statements, and guidelines for pregnant and birthing women. So in terms of what care should be available to you as a pregnant woman and a woman going through labor and birth, you should know that the WHO very clearly states that all pregnant women, including those who are confirmed or suspected as having an infection of coronavirus or COVID-19, have the right to high quality care before, during, and after childbirth. And this goes for all stages of your pregnancy, your prenatal care, while you're in labor, after you give birth, while you're in the hospital, and your follow-up postpartum care. And diving a little deeper into that definition, the WHO also found it necessary to define exactly what a safe and positive childbirth experience includes. And that brings up some of the relevant topics that we've been hearing in the news and we've been talking about, and some of you even asked questions about. That is being treated with respect and dignity, having a companion of choice present during delivery. So I know this is one that's made headlines recently and is of discussion because there are notable hospitals, especially some private ones in New York City and around New York, who are currently not allowing any companion, whether that be a spouse, a partner, doula, etc. And although the mayor of New York City did come out and say that at every public hospital a companion would be allowed, that statement did not apply for private hospitals. So this is a very important topic, and you should know that it is your right to have a companion, and this is a much bigger topic that many of you may have specific questions about. But at the time being, aside from those private hospitals in New York, we do not know of other hospitals who've banned all companions. So far, worldwide, the companionship has been limited to one at this time. So a safe and positive childbirth experience also includes clear communication by maternity staff. That can be difficult at this time because they are estimating that maternity staff is able to spend about 30% of the time that you're in labor with you. So 70% of the time they will not be available to you, and that's because of increased demands on the healthcare system and being short-staffed. Appropriate pain relief strategies, that can be medical or non-medical, and mobility in labor where possible, and choosing the birth position that you want to give birth in. These are all your non-negotiable rights, and the beginning of a positive birth experience is being informed and knowing that this is what you are entitled to, global pandemic or not. So that's really important to know. Now let's talk a little bit about what we do know about COVID-19 and what it means for us as pregnant women. So what we do know is actually really comforting and really at least makes me feel at ease the more the research is released, although it is case by case at this point. We don't have any large bodies of research, but this is from the research that we do have so far. We know that there's no evidence that pregnant people are at greater risk of infection or severe illness with COVID-19, and that we are only considered a vulnerable group or an at-risk group simply as a precaution, not because we have any specific vulnerability to this coronavirus. There are actually, this is the 7th coronavirus falling in that category that we know of globally, and there are other coronaviruses like SARS and MERS, and also influenza, by the way, which we do know that women are at greater risk of infection and having severe illness from, as opposed to this COVID-19. So it's not as bad as other infections for us as pregnant women. There's also no evidence of parent-to-baby transmission during pregnancy that has been published thus far. So all the samples of breast milk, of cord blood, of placentas, of amniotic fluid, everything that has been tested thus far from pregnant people has come back in with negative results. And that finding right there goes to influence the recommendations of a lot of the international bodies that I'm going to cite in just a few minutes, like the WHO, the Royal College of Obstetrics and Gynecologists, and other bodies around the world. So we're going to talk about that, continue talking about that. And there also have been no reported maternal deaths from COVID-19. So this is all very promising. What we don't know yet, and I say yet because obviously this virus is still relatively new. We're only about a little over a month into it. So the research is really just catching up with what's happening. So what we don't know yet and what's unclear is the outcome of preterm births. So we do know that due to changes in our bodies and in our immune systems, we know that pregnant women can be badly affected by some respiratory infections. And therefore, that's why we're taking these precautions. but we don't know exactly how this virus is affecting women. And in China, with the research coming out of there, because there's the most cases and the most pregnant women who were infected, the data that we have is from there. We do see that many of the women gave birth preterm, and the average onset of labor after diagnosis was 13 days. It's unclear from the data if this is because the preterm birth was because of the medical intervention of cesarean. We know that over 90% of the women in China who were diagnosed ended up having a cesarean. We don't know anything about the cesareans. We don't know why they were performed. And so not much can be extracted from this data. We don't have any data on outcomes for COVID-19 infection in the first trimester, and that's simply because of the timeline and when this virus came out and when women became infected. So I'm assuming that as time goes on, we will get some data about that. And we do know that there was one stillbirth in China, and that was a baby that was born at 34 weeks. But again, from this case, there's not enough evidence to know if it was the infection that increased the risk of the harm to the baby, or it was this woman being unwell and other factors that had to do with her pregnancy unrelated to the virus. So what are the recommendations of the global bodies around the world who are directing pregnant women and our healthcare providers? So in terms of separation from the mother after birth and breastfeeding guidance, Evidence-Based Birth put together this table, and I wanted to share with you because it kind of shows very clearly the difference. So the World Health Organization, the Royal College of Obstetrics and Gynecologists, and then the last one is from Canada, all are in unison and agreement that there should be no separation of mother and baby. Skin to skin should be fully encouraged, as well as rooming in. And that if the woman, and this is for women who are infected or suspected of an infection with COVID-19, and that precautions should be taken, but that separating mom and baby is a very serious move and should not be taken lightly. And in the case of COVID-19, they do not recommend it. And then also in terms of breastfeeding, strongly encourage the opportunity to breastfeed within an hour of birth. And if the mother is too ill to breastfeed, to express and have a healthy caretaker give that bottle of expressed milk to the baby. Now, it's important to note that the guidelines from the CDC and therefore the ACOG, which is the American College of Obstetrics and Gynecologists, vary somewhat. It's interesting to note that the CDC released their guidelines on February 18th regarding COVID-19 and have not been updated since. The other bodies above in the top part of the table released their guidelines anywhere from March 13th to last week. So they're very updated, and they've been continued to be updated. So the CDC has not updated these guidelines since February 18th. They came out with this statement on February 18th and again, have not updated it. And the ACOG bases their recommendations off of CDC guidelines. So it's not surprising that they are supportive of one another and in line. If you are in the US right now, it's also likely that your care provider or your hospital will feel pressured to adhere to CDC guidelines. And that's why I am specifically presenting you with global information here, because first of all, we have women from all over the world listening to this and logging in, and second, you should know where these guidelines are coming from and kind of the rationale behind them. So the CDC and ACOG say that care providers should consider separating mother and baby on a case-by-case basis, depending on the illness, but that also the mother's wishes should always be honored. So if you are sick or suspected of being sick, but you wish to stay not separated from your baby, then those wishes should be honored. And regarding breastfeeding, they both say that we should consider having someone who is not ourselves as a sick patient, if we are the sick patient, feed express breast milk to the baby. So those are the current guidelines there. So that all being said, it is important for us to remember that there are things that are in our control and that we have control over in pregnancy and birth, even and especially right now amidst a global pandemic. There are many things that are not in our control with what's going on in the world right now, with what's happening with hospital policies right now, with what our healthcare providers are deciding. But there are many, many things that we do have control over. So let's start with the basics, and that is our safety as pregnant women. Washing our hands frequently. You know, we've all seen those hilarious videos going around about singing happy birthday, the 20-second soap and water, effective and often hand washing. Observing social distancing guidelines. Now, this is going to vary depending on where you are in the world. Currently, where I am, in Israel, we're not allowed, as of 24 hours ago, more than 100 meters from our home, unless it is for the supermarket or pharmacy. And that if we are 28 weeks plus, which seems to be 75% of the people on this call right now live, we should be particularly attentive to social distancing and minimizing contact with others. And yes, that means everyone outside of your immediate four walls and your home. Because if you're seeing other family members or friends in the neighborhood, you don't necessarily know who they are coming in contact with. And we do know that the average time of onset of symptoms for this virus is 5 days. So the likelihood is that someone is probably asymptomatic for 5 days, meaning they have no symptoms of the virus, but they are contagious. And that's a risk to us as pregnant women. So you have complete control over who you see right now and who you come in contact with. So take that very seriously, even if your national or local guidelines are different from what I just stated are mine here. Avoid touching your eyes, nose, and mouth. That's been a really hard one for me, by the way. I'm just used to it, but it takes practice. And practicing respiratory hygiene, which is, you know, if you're going to blow your nose on a tissue or something like that, throw it away right away and wash your hands. Or covering your nose and mouth with your elbow if you're going to cough, you know, most things that we know. And it's also important to know that in the research that we have seen, pregnant women don't present with the typical symptoms. So almost half of the women who are pregnant and were pregnant and were diagnosed did not have a fever, for example. So you may not present with those typical symptoms of the cough and the fever, even if you are infected. So that's why social distancing also really just is so important for us as pregnant women. In terms of our prenatal visits, I wanted to give some guidelines here. Just have got a lot of questions about what to do about prenatal visits, what to do about blood work, all this kind of stuff. So basically, because everything is really drastically different in every part of the world, in every region, in every state, in every country, the most general advice that I can give you that's applicable on this kind of setting here in this format is to contact your care provider a few days before your scheduled appointment. Not like now if you have one next month, but if you have an appointment, today's Thursday, if you have an appointment next week, I would contact on Monday, see what the updated guidelines are. Maybe for that specific appointment, you don't need to come in, and if you have a blood pressure cuff at home or something, you could do some things at home, and they might tell you to skip it and wait till the next checkup. It all depends on where you are, on what your healthcare provider is recommending at this time. So that's why I say just wait a few days before the appointment and call them and see what they advise you. If you have an urgent problem with your pregnancy that's not related to the virus, then just use the regular emergency contact protocol that you have anyway. Something like if you're bleeding bright red blood, more than 1 tablespoon, if you don't feel fetal movements for the set period of time that you're supposed to be counting fetal movements. I hope you all are, especially all my third trimester friends out there. Then you definitely should be contacting your emergency services, whether that's an emergency number for your healthcare provider or the prenatal or ER, L&D ER some people have. So whatever that is, you should contact them immediately. If you think you may have been exposed to the virus or you're having some sort of symptoms, don't go into your appointment without telling them. Most people know this by now, but call ahead. They'll have a specific time and place and instructions for you to come in. And regarding reduced number of visits, which we're all kind of facing, I personally was supposed to have a visit on Sunday that I don't have anymore. My best advice is just not to reduce your number of visits without first discussing it with your maternity team and agreeing with them on what is reasonable and what feels good for you right now, because they as healthcare providers are still providing healthcare services, and we need to feel cared for and get our essential prenatal appointments in. So this is a discussion, and you should not think of it as a one-way street of them informing you what's going to happen, but more of an opening up the discussion and agreeing on, whether it's spacing them out a little bit more or whatever, coming in for every other, whatever feels good for you. There are a lot of other things in your pregnancy that you also have control over. And we're going to move away right now from talking about the virus and just generally talk about pregnancy and what we have control over, because this is a very helpful topic right now. And there's actually a lot that we can all be doing as pregnant women to help increase and maximize our health, our maternal health, and our baby's health. So we are going to discuss prenatal nutrition briefly. We're just going to touch upon each of these subjects because really in the full course that I teach, each one of these is a whole lesson, but we're going to highlight prenatal nutrition, prenatal vitamins, movement, mindset, and preparing for birth and baby. So in terms of nutrition, this has to do with what you put into your body. Now, if you're like me, and you've been sitting at home all day, and you may have been mindlessly snacking a little bit more than normal. My best and most simple advice for all of us as pregnant women is to eat real food. I know that can be hard right now. I actually just did a poll on my Instagram asking my audience what is hardest for them to get a hold of right now at grocery stores or online, however you're ordering your food right now. And about more than half said that meat and poultry was the hardest to get a hold of. And then next in line was fresh fruits and vegetables. So what I would recommend is looking up some local farms and seeing if you can get a delivery that is not through the grocery store. which may be a great option right now. But in general, real food means just eating as close to the source as possible, trying to eat the fruits and vegetables that are in season, eating them as soon as possible after they're picked, which again is another pro get your stuff from a farmer option, and without pesticides. That's going to make your food as nutritious as possible. So what should be included in all of our diets as pregnant women? Vegetables, fruit, meat, poultry, fish, seafood, nuts, seeds, legumes, and healthy fats. And if your body doesn't react poorly to it, also dairy and whole grains. And dairy, I want to just note on that, full fat dairy. We don't need any low fat dairy right now in pregnancy, especially, and definitely in postpartum. A quick note, because a lot of you are in third trimester, postpartum, especially if you're breastfeeding, the nutritional demands on our body are actually higher than they are during pregnancy. Many women don't know this and want to drop the baby weight really quickly. And that is probably one of the worst things that you can do, is undereat or not eat a full nutritious diet, especially in terms of your breast milk quantity and quality. So making sure that you're keeping up on your nutrients and on your diet well into, postpartum, and keep taking those prenatals, which we're going to talk about in a minute. So your body does have an increased need, but more often than not, we end up talking about the increased quantity, like how many more calories should I eat per trimester, when actually that's not so much what it all comes down to. The increased quantity varies greatly from woman to woman when actual research has been done on this, and they've found that, even though the recommendation for second trimester, for instance, is to add 300 calories, they found that in real women, some women's bodies need as little as 70 additional calories, and some women's bodies need more than 300 additional calories. It really varies, and unless you're working closely with a trained nutritionist, it might be impossible to know exactly how much more you need. So what you can do, especially in times like these, when food is not the easiest topic right now, is to increase the quality as much as possible. Buy grass-fed, buy organic where possible. It's less likely to be sold out because less people go for those options. And you can also usually directly source from a farmer, which is maybe more accessible for you right now than the grocery store. I'm not sure, but I did just try to order something on Thrive Market today to a friend in the US. And I know that they were telling me it was going to take at least 14 days. So I would keep looking for local options in terms of food. The nutrients that your body needs do significantly increase. So for instance, our bodies need a significant amount more of vitamin A, of folate, of vitamin B12, of choline, which some of you may never even heard of iron, of iodine, etc. And it's really because of these specific increased needs that we come to the topic of prenatal vitamins. So prenatal vitamins, I want you to think of as just basically an insurance policy for you and your baby. It's not a supplement for eating a healthy, nutritious diet, but it is an insurance policy. So because there are some nutrients that are difficult to obtain in the amounts that we need during pregnancy from food alone, especially if you have food aversions, especially if you're vegetarian or you're vegan or you follow a specific diet. Some of those nutrients that are specifically difficult are ones that I just mentioned above, and also vitamin D, vitamin E, iron, zinc, magnesium, and folate. Now, folate is a good topic because it's going to lead me right into my next point on prenatal vitamins, which is that not all prenatals are created equal. No, the $9.99, all-in-one women's prenatal that you got from Walmart is not the same as the Mega Food Baby and Me prenatal that I take that has activated forms of B vitamins. Basically, why are all prenatals not created equal? For a few reasons. One of them being that to save money and to keep costs down, most companies use synthetic forms of the nutrients. So this is not only a different form of the nutrient than the form that is found in the food naturally, but it's also a form that's less readily absorbed by your body. So it's less bioavailable. What you want to look for on a prenatal vitamin are activated B vitamins, which means it's easier for your body to utilize. One example of this is folic acid versus folate. Folic acid is the synthetic form of the nutrient folate. So what you want to look for folate on your prenatal is that it says L-methylfolate 5 or something like that, or L-methylfolate is the main word you want to look for. The reason this is so important, and this is the one that I'm bringing up among all of them, is that research has actually found that up to 60% of the population has a mutation in the MTHFR enzyme, and that mutation makes our bodies less able to absorb folic acid, or the synthetic form of folate. So if you have not been tested for the MTHFR enzyme gene mutation and you don't know if this applies to you, there's a 60% chance that you're not absorbing or adequately absorbing the folic acid that is in your prenatal. And that's why it's important to buy a prenatal that has activated forms of B vitamins. So if you are part of my Motherhood Empowered Facebook group, by the way, you can get access to I have my favorite prenatals recommendation list, and I have a few prenatals on there that do all have activated forms of vitamins. So that's one part of the discussion. The other part of the discussion of why they're not all created equal has to do with the percent daily value that you see on the side of the label. So we all like to look at that label and say like, oh, 200% of my daily value of vitamin C I'm getting in this one pill. I don't even need to eat any vitamin C. Not exactly. So those RDAs, those recommended daily allowances, actually came from studies that were done on adult men. The data was then extrapolated, manipulated, and applied to pregnant women using advanced guessing. And when actual research has been done, we have seen that the actual levels needed for pregnancy may be and are anywhere from 3 to 10 times higher than the current levels that are recommended by the RDAs at the moment. So one of the big ones here is vitamin D. It's estimated that 20 to 85% of women worldwide are deficient in vitamin D, with certain areas that don't get so much sunlight. The population is up to 98% deficient in vitamin D. There is a line, like 33 degrees something, geography is not my specialty, that half of the US falls under, and it said like if you live below that latitude line, then you have a 98% chance of being deficient in vitamin D. So that's one thing. It's also, we know from research that 48% of Americans don't consume enough magnesium. And it's even more common to be magnesium deficient when you're pregnant. So these are all really important things to know. And again, There are other vitamins that you should be looking out for in your prenatal. I have a list of them here. If you want to screenshot, you're welcome to. Check your prenatal for these vitamins and make sure that they're in there. And if not, make sure you're in Motherhood Empowered and you ask for the free download or you access the free download of my favorite prenatals and get on an effective prenatal insurance policy today. So movement. Another thing that we have complete control over every day is how we move our body, how we sit, how we stand, how we sleep. This is all so, so important. The benefits that we have, that we get from movement are proven a million times over. And just some of them, for those of you who might not be aware, but everything from a decreased chance of developing gestational diabetes or preeclampsia, all the way up to being able to produce 3 times more endorphins, which are natural painkillers, right? Endorphins are natural painkillers during labor. So research actually shows that women who exercise regularly and meet the 150 minutes per week recommended can produce, physiologically, their bodies can produce up to 3 times more of these natural painkillers called endorphins during labor versus a woman who doesn't exercise during pregnancy. And for our babies, we know that our movement and exercise can lead to better outcomes for improved fetal brain development, a decreased risk of obesity for our babies, and type 2 diabetes, and other benefits relating to their body weight, cardiovascular health, and their nervous system development. So really good for our babies for us to keep moving too. That being said, I recognize the challenges. Remember, I can't move more than 100 meters from my house right now. So my best recommendation for you guys is to check out Expecting and Empowered. If you don't follow these ladies yet, they are hilarious. So like raw, real, just you feel like you're friends with them when you follow them on social media. I love those kind of people who just are unfiltered and keep it real. And it's 2 sisters named Crystal and Amy. Crystal is a women's health PT. Amy is an RN and a personal trainer. And they actually have these bi-trimester guides that go week by week in pregnancy. And if you follow me on social media, you've probably seen me posting about their workouts because you can do them with your kids hanging all over you. You can do them in, isolation in your home. You can do them without any equipment, basically. You really just need like some simple bands, and I don't even have hand weights, so I use my cast iron pots or my laundry detergent as weights. And the best thing about them is they are specific to the week you're at in pregnancy. So you're really moving your body in a way that is beneficial for your body, that is safe for your body, and you're including in that flexibility and pelvic floor exercises. So it's really a win-win. They just put up on their blog today, that's what the screenshot is here on the side, some sample workouts for every trimester. So if you want just some free workouts you can start with now, go to their blog, go to their most recent post, and you can try some of the workouts. If you do decide you want to buy one of the guides, you can also get 20% off right now. You put in this code, take care, plus my name, and it is an affiliate link, so I do get a tiny bit of commission off of that. But it's also a great deal for you. So that's what I'm doing personally, because I don't have any other options right now. I mean, obviously, gym memberships are closed. I wasn't a member of the gym anyway right now. And this is all I can manage with a toddler at home. So what I also want to say is that you do need to be careful when exercising during pregnancy because of relaxin. So we have an increased flow of the hormone called relaxin in our body, which makes us feel basically super flexible. And the job of this hormone is to help our pelvis to contract and open and move around, and adapt for our baby and help our baby to move through our pelvis during birth and during pregnancy. So while it's really helpful and has a great job, it also can make us feel super flexible and think that, like, especially during prenatal yoga, like, oh, I can go deeper into this position. You probably don't want to, okay? You want to protect your muscles and just be careful. And in terms of how we're sitting, standing, and sleeping, which, is really, we don't think about that much, we could be doing a lot of damage without knowing it. And my best recommendation here is to Google spinning babies. If you have never heard of them, your world is about to change today when you go to their website and start doing their daily essentials, their 3 sisters of balance. And you essentially, what you'll be doing is loosening, untwisting, and releasing the ligaments that are very tight inside your uterus from just crossing your legs, wearing high heels, sleeping with one knee up, all the things we do that cause asymmetry and imbalance inside our body and usually cause our babies to turn in a suboptimal position for birth. So anyone out there whose baby may be breech right now, or transverse lie, or OP, which is sunny side up when the baby's face is facing out, this is what you need to be doing right now, is spinning babies moves. So moving on to mindset. Our mindset is something that we can control from a moment-to-moment basis. And I know this is a difficult topic right now amidst everything that's going on, but it is probably the most important thing that we're going to talk about, because really this is where it begins and this is where it ends. And your mental and emotional health is the foundation of your being a healthy person and being a healthy partner and being a good mom and parent also. So it's important to know that in normal times, in non-pandemic times, the rates of prenatal anxiety and depression, prenatal, notice that word, okay, not postpartum depression, prenatal, meaning during pregnancy, is 25%. So 1 in 4 of us are going to be affected by anxiety and depression. Right now, during the global pandemic, those numbers are skyrocketing. What I want to say about that is that this doesn't always have to be a happy time. I don't know about you guys, but I am a little bit zoned out to the voices saying, you should be so happy, you're pregnant, you're bringing new life into the world, like you should be grateful and you should be this and you should be that. Like, don't tell me what I should be. I'm 35 weeks pregnant. So that applies always, and especially now. And if you're not feeling super happy and over the moon and lovey-dovey, then that is totally fine. And you should feel all those feelings. And you are very, valid. That is a valid emotion to feel. And I am giving you permission right now to feel all those feels. In a normal pregnancy time, there are stressors in pregnancy, right? Like we worry, is the baby growing? Is everything progressing? Am I going to have a healthy pregnancy? Am I going to start bleeding? Is the baby moving? Is everything okay? Am I eating everything I'm supposed to be eating? Am I exercising as much as I'm supposed to be exercising? All of those things are normal thoughts that flow through our head and normal stresses. And right now they are amplified. And the reason that I'm talking about mindset and the importance of our mental and emotional health is because it's not just important to help you feel better. It's important overall for your well-being and your baby's well-being. Stress can actually lead to preterm delivery. It can lead to high blood pressure, which we know is dangerous for pregnancy. It can lead to a lowered blood flow to your baby. It can affect your cortisol levels, which control baby's brain development. And it's not always the stress itself that's causing these outcomes. Sometimes it's what the stress does. So the stress then inhibits us from taking care of ourselves. Because we're so anxious, we're not eating well, or we're not sleeping well, or we're not exercising. So that's why I say that this is really the most important topic of everything that I'm going to talk about. Because if we don't have a good handle on our mental and emotional health, there's no way that we can take care of ourselves in all the other ways that we need to be doing that right now. So what do I recommend? How to manage this? The first thing is just to notice, to take 2 minutes to yourself once a day and check in, and just put your hand on your heart, put your hand on your belly, close your eyes, take a deep breath like we did at the beginning of this class, and just say, like, what is going on in my body right now? What am I feeling? And just notice it. Once you notice that there is stress or there is anxiety or there's whatever, brainstorm ways that you can manage it. Sometimes it just comes down to needing to do less of the things that stress us out, which right now may be like, I don't know, online homeschool, virtual homeschooling your kids, and doing more of the things that are enjoyable, which is maybe getting outside and getting some sunshine, or doing some movement, or cooking a nice meal. Maybe cooking is a stressor for you. I don't know. This is very individual. But think about minimizing the things that are stressful and maximizing the things that are enjoyable. Some of the other things that we can do on a daily basis are mindfulness. If you've never practiced mindfulness, it's kind of like meditation, but it's not about clearing your mind. It's just about noticing and getting in touch with whatever's happening inside your body. So if you are inside my Motherhood Empowered group, yesterday, around 24 hours ago, I hosted a wellness expert, Boston-based Carrie Axelrod, and she did a wonderful meditation, guided meditation that was super helpful. It was about 20 minutes long, really accessible. It's on my page. So go join the group afterwards if you're not there, or listen to the replay if you haven't yet. Even doing something like that, 5 minutes. If you have on your phone, download the Calm app. They have really short, easy, guided things you can listen to. Go to sleep earlier. I mean, I'm guilty of this too. I've been staying up super late researching for this class all week, but getting adequate sleep and steady hours of going to bed at the same time every night is one of the most best healing things you can do for your body and your mind. And then just getting help. Don't be afraid to reach out. Even now, there are lots of therapists out there who are offering online services, virtual services. Just because the world is in a global pandemic does not mean that you don't have access to mental health counselors and support. So get the help you need, and don't be afraid. Don't think like, oh, well, everyone's freaking out. It's a global pandemic. Like, okay, but that still might mean that you need help. So be empowered to do that. Last on our list of what we can control is preparing for birth and baby's arrival. You can start doing that today, and it's not too late. I don't care how late you are into your pregnancy. If you are a day before labor, there's still something that you can learn. So what you learn now makes a difference. Where you're getting your info really does matter. They looked into some of the Google searches that were being conducted. So they found that of information that was searched on the internet on the topics of pregnancy and birth, 40% of the results, or 40% of the searches yielded incorrect results. Actual information that was incorrect. So that's a really scary statistic to me when I know and I hear from my clients that most people are Googling all day long. And especially now, if you can't reach your doctor, you're Googling things that are happening, or you're Googling, whatever. That is not good news for us pregnant people. So getting your information from reliable sources is really important. And I'm going to talk more about that on the next slide in terms of resources. The how is really important, how you do this. So basically, you want to be making your decisions in pregnancy and in birth as an informed and confident decision maker from a place of strength. You do not want to be making decisions from a place of fear. That's just a general good life tip, I feel like, but also in pregnancy and in birth, it is really important that we make our decisions from an empowered and informed and confident place. So why we would do this and why we would, get educated is that there are huge improved outcomes for women who undertake childbirth education and who enroll in a comprehensive course during pregnancy. Some of the, a lot of the benefits relate to pregnancy and birth themselves, having less interventions, having higher birth satisfaction, but also, you'll be interested to know, and Lamaze did a study on this, that couples who took Lamaze courses actually reported higher satisfaction in their relationship after their child was born. Now, anyone here who's had a child before could say, that sounds like a crazy statistic. I don't know anyone who's had increased satisfaction in their relationship after they had a baby. And if you're pregnant with your first baby, you probably have no idea what you're in store for. But this is one reason that I personally, in Module 6 of my course, have an entire identity questionnaire and activity for my couples to go through so that they are not shocked by this postpartum. So this is really important. This is something that you can do today. And now everyone is putting, trying as much as possible to put childbirth courses and resources online so that you really have no excuse and they are accessible to you. So what are those resources? The ones that I recommend, of course, and I've said a few times here, join my Motherhood Empowered Facebook group. It's free. I post lots of free stuff there. I show up live. You can have access to me. It's a great place to be. You can connect with other moms and find out lots of info. I love Evidence-Based Birth. They have a COVID page right now. Like if you Google Evidence-Based Birth plus COVID, you'll get right to their page, and they are staying on top of the research better than anyone who I've seen. Just collecting it from all the different bodies and organizations worldwide. Every study that comes out, they do a summary. And on top of that, they have created a bunch of other resources for us pregnant women during these times, including a digital doula directory. So yes, I know one of the topics on here was talking about how doulas are not allowed in hospitals right now. I still am encouraging couples to get the support of a doula, because doulas are incredible resources, and just like I'm talking to you right now through the screen, they can talk to you through the screen, and having their professional guidance and support at such an uncertain time is so incredibly helpful. Having someone who has been through this numerous times, this is what they do as a profession. They know how to guide you to talk to healthcare providers. They know how to guide you to help you advocate for yourself. They know how to interpret for you. These are the options they're giving you, and this is what it means in plain English. Doulas are really an invaluable resource, and continuous support from a doula alone has been shown to decrease cesarean rates by almost 40%. So that's just one small statistic, but there are incredible benefits to hiring a doula, and a digital doula is just as wonderful. I have decided to reopen my Empowered Childbirth course. So I originally had launched my last version of it a few weeks ago in March, and that's obviously because I'm 35 weeks pregnant. But I did actually decide to create a fully automated version of my course because I full-heartedly believe and have been hearing from women that they need online options right now. I know a lot of the in-person childbirth, all the in-person childbirth classes have been canceled now, and not everybody's online. And I have an evidence-based comprehensive course that has helped many, many women and can help you. So if you're interested in that option, you will be emailed the information following this webinar, and I will offer you a discount for attending today, and you can start that with me on Monday. If that full comprehensive course is maybe not for you and you just want to take like a short 30-minute course on a certain topic, I am also a presenting partner with Lamaze, and so that means that I have access to their one topic. They're kind of like mini courses. So there's like an intro to birth, there's a breastfeeding course, there's a new parents course, baby care course, there's an what to do if you're facing induction course, a cesarean course. You get it. It's like basically like a childbirth course, but broken down into mini courses. And so each course is, I think, between $20 and $30, each like small mini class. So that's how that works. And I will also send you those links. And these are some of the resources that I have to offer you. Now I wanted to take the time to answer some of your questions. So I did get questions from the form, and I will also, that you submitted, and I will also read a couple in the chat here, but I think that's all we're gonna have time for since we're already a few minutes over, and I want to respect everyone's time here. So in terms of the questions, the first question says, how does it work with blood tests? Is it safe to go to a clinic now, or is it better to go to a private clinic or have them done at home if that's an option too? So first of all, in terms of that question, blood tests are still important. The WHO is still recommending that you go for your routine prenatal checks. That includes blood tests. That being said, the specific option that's right for you, I can't say. I also can't say whether a more public clinic versus a private clinic would be more safe. It would depend on their hygiene practices specifically. And as in terms of doing lab work at home, I don't know of any such option. I personally have a home birth midwife, and she does not conduct lab work at home. So that is not something that I know of. About going to your regular checks, I addressed that earlier in the webinar. So the best thing that I can say about that is to contact your care provider a few days before and see what the most updated policy is. I do know that home birth midwives and birthing centers are being overwhelmed right now with women's requests for home birth and for birthing centers. I think that is a wonderful thing in general. The evidence shows that for low risk pregnancies and healthy women, that home birth is just as safe, if not a safer option than hospital birth. Again, for low risk, healthy pregnancy, women with healthy pregnancies. There are certain rules and regulations around home birth depending on which country you live and where you live. So if you have a question, a specific question about home birth, you're welcome to get in touch with me via email or social media and ask me that question, and I'll be happy to follow up. And the last part of this question was, who should look after my kids if I have other kids at home and I'm pregnant and I'm having a hospital birth? I can't really tell you who should look after your kids. It's best to keep at-risk populations out of the equation. So that would be anyone who's over the age of 60. I know that's not always an option for everyone. So the biggest thing that I would do is that if you at least have a couple weeks before your estimated due period, I would try to identify someone who has been following very strict social isolation rules and has availability, and see if that person would be willing to, basically cut off all contact with others as much as possible so that they can stay safe and then they can watch your kids. That's what I would do, and that would be my best recommendation. I have another question here that says, have I seen moms getting quarantined from their babies after birth, and how to handle, so about being quarantined from their babies after birth, only have heard of it being done in China so far, even though, despite the CDC and ACOG recommendation that I said, which follows the Chinese recommendation. So we've only heard of it being done in China. And again, that is not consistent with the WHO and other global bodies and their recommendations. How to handle canceled birth classes and hospital tours. I would refer you back to my resources page. You are more than welcome to join us in our Monday class. I would look for other options online, and absolutely not forego childbirth education because of your in-person class being canceled. Online is a great option. And I see people in the chat. Yes, it's called Expecting and Empowered. That's the workout program, and I will send that out with the replay to this call. I will link to their stuff. I'm a first-time mom. What extra precautions can I take closer to my due date and or after the baby's here to make sure things are safe for both me and baby? So I would just refer you again back to the slide that we already talked about. It was labeled safety. I would take all those precautions, especially social distancing, extremely seriously, including when your baby has arrived. Really limit who can visit, also for the safety of your visitors and for your safety and your baby's safety. Is it possible to set a backup home birth plan if hospitals stop letting partners join? So this person asked this from Israel. In Israel, we don't expect that hospitals will completely disallow any partners because we're following the WHO guidelines. So we don't expect that to be a reality. However, you can never say never. Best thing I would do is to look up Imahi for this person because they're in Israel. And that is the Home Birth Midwives Network in Israel, and to ask them that question if they're willing to set up as a backup and what their retainer fee would be. And someone else also asked, will they soon admit all hospitals to not letting spouses in? Again, I can't predict that, but because, really all the major bodies in the world, aside from the CDC and the Chinese experts panel, have said that having a birth support person is essential, I don't see that becoming like the global norm for any reason. Okay, and I'm going to be sharing this presentation over email, and I think that's it. I think I answered all the questions. So one just came through. I will answer this and then we will end. What do you suggest in regard to pediatrician visits once my baby is born. I'm in a unique situation where my dad is a pediatrician. I've been keeping my distance from him now since he is still practicing, and I can't be sure what he's exposed to. Would you keep your baby away from practicing pediatricians once they're born? I personally would not. Again, the WHO guidelines don't recommend, skipping any sort of routine care. I think that it is essential to have your baby examined after birth. If you give birth in a hospital, you will have your baby examined by the pediatrician in the hospital. You can then take the time whenever you do give birth to ask that pediatrician what their recommendation is for your baby, because it is important to know, your baby may have a certain situation that needs to be more closely monitored or not. So always to ask a professional is the best advice. I'm not advising anyone to skip pediatrician appointments, and you're very lucky that you have your dad, so that you probably have more options than most people. And that is all. I look forward to seeing you all on social media and connecting with you, and I hope that you have a wonderful rest of your day and a wonderful rest of your pregnancy. And although the world is in panic and crazy right now and it feels really stressful, very soon you are going to have a beautiful, lovely baby in your arms, and there is nothing more exciting than that. So be well, everyone. Thank you for coming.